you, Mr. Speaker. I wish to use this opportunity to update this Honorable House on the status of oncology services that are being developed in the Federation of St. Kitts and Nevis following the official opening of the oncology unit at the JNF France General Hospital on December 6, 2016, and of course noting that at this introductory phase the unit is meant to provide chemotherapy-based treatment for cancer. As stated earlier, the unit is located at the JNF France General Hospital and has been strategically placed at the back of the private ward via a separate security-controlled access point. Staffing of the unit. The unit is staffed by a complement of 4 individuals made up as follows: an oncologist recruited from Cuba, Dr. Yanelis Leon Duran, 3 staff nurses in the persons of local staff nurse Isilma Wilkin, who will shortly be upgraded to assistant nurse manager, given that every department within JNF France Hospital is either led by tradition by an assistant nurse manager or full nurse manager. The other 2 staff nurse positions are held by Filipino nurses, namely Catherine Cabello and Phoebe Cates Kayakap, with a combined experience in oncology nursing of 12 years. Additionally, Mr. Speaker, I wish to point to the layout and features of the facility in that there are 3 treatment rooms with 5 treatment areas, namely 1 bed and 4 reclining chairs for the provision of chemotherapy-based drugs. There are also 1 examination room, a doctor's office, a nurse's office, a biosafety cabinet with medication mixing room, and a utility room. Treatment history, Mr. Speaker. I am pleased to announce to this Honorable House that the first chemotherapy treatment was done on Monday, January 9th of 2017 for a duration of just over 3 hours. A second patient was also treated on January 13th, 2017 for a duration of 3.5 hours. A third patient is currently receiving hormonal treatment this present month. The types of cancers being treated thus far are namely breast and colon, and all patients thus far have been females between the age range of 31 to 49 years old. There are 3 additional patients currently being prepared for treatment. Mr. Speaker, it should go without saying that government is proud of this accomplishment in reaching this milestone in the advanced healthcare delivery of the Federation. Just last month, I would have shared with this Honorable House some glaring statistics with regards to our challenges with non-communicable diseases, of which cancer is one. We can proudly state now at this point that chemotherapy-based cancer treatments can now be safely, ably, and effectively delivered right here in St. Kitts and Nevis, and that this new service brings with it a number of benefits to cancer patients, including the following 3. 1, the elimination of the need to secure added financing to cover the cost of airfare and accommodation in a foreign country in order to receive chemotherapy. 2, the privilege of patients having their treatments done right here at home with the strong support system of family, friends, and communities to help them through what can be a very grueling process. Very often it is neither possible nor practical to have family members or friends along with you on an overseas trip that is already stressful, largely due to the investment of time and money that is demanded. 3, patients will be in a more peaceful state during the treatment phase due to the support system that they have from being around their friends, families, etc. And of course, there is enough medical evidence to support the theory that a positive mindset and environment will go a long way in assisting cancer patients on the road to recovery. In closing, Mr. Speaker, I would like to use this platform to encourage each and every citizen of St. Kitts and Nevis to do more along the lines of policing his or her health, to have regular medical checkups, to participate in regular screenings for cancer, especially pap smears in the case of women, to screen for cervical cancer, PSA testing to screen for prostate-specific antigen levels among our male population so that we can rule out the likelihood of prostate cancer, and also colonoscopies for both sexes to screen out for the growth of polyps that can then graduate into full-blown colon cancer. It cannot be stressed enough that it is much easier and cheaper to prevent illnesses than it is to treat illnesses. And of course, early detection saves lives. We must all be reminded that if we are to advance towards a prosperous nation, we are really saying that we are prospering through the decision and the advocacy and the practice of a healthy nation. Thank you, Mr. Speaker.